and welcome to another episode of Fridays with Fawn. I'm your host, Fawn Lopez, publisher of Modern Healthcare and Vice President of Crane Communications. Joining me today is Indu Lew, Pharm D. Dr. Lew is Senior Vice President and Chief Pharmacy Officer at RWJBarnabas Health in West Orange, New Jersey. Indu, welcome, and thank you for joining us.
And thank you, Fawn, for having me here today. And thank you for being such a strong advocate and a champion for women.
Oh, thank you so much for your kind words. It's an honor. So, Indu, share with us a bit about your career journey. What got you interested in pharmacy, and how did you advance to become the first woman to serve as Chief Pharmacy Officer with the system?
Well, Fawn, I've always felt the need of service to others. I've always enjoyed working on a team. And when you're a pharmacist, you work with a team of healthcare practitioners. And as a pharmacist, you can truly make a difference in someone's life. So that's how I started on the idea of becoming a pharmacist. I actually started within our system as a pharmacy technician in one of our acute care hospitals, left for a number of years and came back to our system as a clinical pharmacist. When I was working in that hospital, I was presented with a unique opportunity. I had two job offers at the same exact time. One offer was to work as a clinical pharmacist in a cardiology clinic that was being created with a world-renowned cardiologist. And the second job was to work at corporate. It was for 18 months at grant-funded position. So at the end of that 18 months, I essentially wouldn't have a job. So normally, growing up, I was not a risk taker, but here, really taking that risk to move to a corporate position, and it was deemed as a fellow position, so a very introductory position, working as a fellow for an 18-month period of time. But I looked at that 18 months as really an 18-month job interview. At the end of the 18 months, and during that time, really being able to interact with senior administration, getting very creative with different initiatives and ideas. So at the end of the 18 months, they offered me a job as a director. I was then promoted to vice president and then to senior vice president as a chief pharmacy officer. So came full circle from a pharmacy technician to being the chief pharmacy officer.
That's so awesome. So I have to share something personal. I started college majoring in chemical engineering, and I really didn't like my experience too much. So during my sophomore year, I started thinking about changing my major, and I was seriously considering pharmacy. And then when I talked to a dear friend who was in pharmacy school, and he said, well, yeah, you really, organic chemistry and all of us really is important prerequisite. And I had just finished organic chemistry, the class, and I did not like it. It was so hard. And I was like, no, I'm not going to. I can't become a pharmacist. So I have so much respect for you and pharmacists out there.
Thank you.
And the work that you do.
Thank you.
So I understand that you serve on several committees at the system. And one of those committees is the Women's Leadership Alliance. Can you talk a bit about that committee and the alliance?
Sure. So the Women's Leadership Alliance was created by one of our senior executives. I served as the chair of the Professional Development Committee for the Women's Leadership Alliance. And really, the purpose of this committee is to have a place where women can be mentored, where they can be exposed to senior leadership, where they can be involved in having those types of conversations, developing workshops where they know how to negotiate, where they can have those crucial conversations. They can get involved in the community. So it's a wonderful organization, and we call it the Women's Leadership Alliance, but really it's any leader within our system, man or woman, invited in to the Women's Leadership Alliance, because we need people to be able to support and promote women within our organization. So it's been very, very successful. The membership continues to grow, and it really is a wonderful opportunity for women advancement.
That's great. And I love the approach of, creating diversity. We need to work alongside men, right, in order to move any important effort forward. So we've been told that you encourage your team to fail forward. Can you talk a bit about the culture that that sentiment has built throughout the pharmacy department and perhaps the system? What inspired you to adopt this approach?
So when we talk about failing forward, I think we need to back it up a bit. And really, in order to fail forward, you have to create an environment and a foundation of trust. Trust really is the currency of leadership. And trust in human relationships is bi-directional. So the team has to trust in me as a leader, and I need to trust in the team. And when you have this environment of trust, what it does is it sparks ingenuity, it sparks creativity. People aren't afraid to bring forth new initiatives, and they know when they bring these new initiatives in place that if they happen to fail, failing really is an opportunity to see a potentially different solution, how they need to pivot, what are other resources they need to bring in. So when you fail, you're really looking at it as a learning opportunity, but that won't occur unless there is an environment of trust that's been created amongst your team.
That's so awesome. Love, love, love that approach. So 2020 was certainly a challenging year, and rolling out a vaccine during a global pandemic, and we've been hearing about it, is very challenging. What challenges have you faced, and what have you done to overcome them?
Well, the pandemic in and of itself, so difficult. And then you need to roll out a vaccine program while you're taking care of COVID patients, while you're trying to maintain business operations. So that in and of itself is extremely difficult. On top of which, information changes so quickly. So in the best of times, you might have a playbook, and that playbook might change monthly, difficult, might change weekly, even more difficult. Here, the playbook was changing daily on vaccine implementation. So the best way to overcome any of those types of obstacles, and it really doesn't apply only to the vaccines, but it applies to any initiative that you're rolling out, you need to have clear lines of communication, clear, concise, simple, transparent, and frequent. And communication here is the key. So when we were establishing these processes, we had daily calls with the teams, and we're the largest academic healthcare system in New Jersey, a very, very large healthcare system, 11 acute care facilities when we're trying to roll this out. So having clear, concise communication plans. And the other piece is recognizing that the end user probably has the best feedback on how to improve. So when you have these lines of communication open, again, going back to the foundation of trust, people will be willing to say, we've started with plan A. I really think plan B is better, or potentially plan E, F, that might be better. Taking this feedback, incorporating it into our plan, and then pivoting very quickly.
And how did you gather the feedback? Was it an ongoing chain of communication? Is there a process in which people offer their feedback?
Yeah, so we have daily huddle calls that happened. It started prior to vaccine implementation. So the vaccine task force, we started around the October timeframe. From that time on, having daily calls before we actually implemented and actually during the implementation piece. Now the calls, we've been now doing vaccinations since the middle of December. So the calls now have moved from daily to 3 times a week, but recognizing at any time we need to bring the group together. What's amazing is that the team is so responsive. And I can give you an example. Just today, we had to have an emergency call at 12:30 p.m. today. The call message was sent out at 10 a.m. Every one of our facilities got on the call. Everyone was attentive. Everyone was embracing the change that needed to happen.
That's awesome. So that's part of the culture.
Yes.
So Indu, what have you learned about yourself as a leader as you manage the system's rollout of the vaccine program?
What I've learned, and this is nothing new, but it was just exemplified, is that it's about the team. If you respect the team, you value the team, you recognize their work, they will soar higher than they even knew that they could. And when you have that respect for the team, then you're able to motivate them and inspire them. You're able to communicate with them and they listen, and you're able to listen to what their feedback is. And the most important thing with any of strategic imperatives is you have to be able to execute, and the team will execute when you show them respect. So it's a great honor to work with the people within our system. Every day it's a wonderful honor, and it was just even greater during the vaccine rollout.
2020 was certainly a very challenging year on so many fronts, on all fronts actually. And as leaders, we dealt with so much. The pressure was enormous. How were you able to manage your stress level and the day-to-day challenges that you faced?
Well, I think it was extremely stressful, not only for myself, but our teammates. They were dealing with tragedy that they've never seen before. They're dealing with situations that they had never seen before. I can't even imagine being on the front line and having to have iPads so patients could communicate with their loved ones. Very, very difficult, while managing medication shortages as well and treatment guidelines changing. So very stressful for myself and the team members. I think the easiest way to manage that stress is really to take a minute and reflect on how lucky we are, reflect that we have family members and friends that are there to support us, and also to be able to support others as well. So I think taking a little bit of time for reflection helps to decompress that stress a little bit.
Such great advice. Thank you so much for that. And I try to do the same. Try to do that every day at the end of the day. Reflect and look for something positive that happened during the day to be thankful for. So gratitude is incredibly important during times like these. Indu, it has been such a pleasure talking with you today. And I can't thank you enough for taking the time out of your busy schedule and sharing with us. We're honored to have you as our guest.
Well, thank you so much for this opportunity. It was a great honor for me as well. Thank you so much.
To our audience, thank you for watching, and keep your eye out for our 2021 Top 25 Women Leaders in Healthcare, publishing in February 15th. As always, I look forward to seeing you again on the next Fridays with Fawn, and I hope that you'll join us at our virtual Women Leaders in Healthcare conference in July. Thank you.